The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. It's the last Friday of February. 2021 is off to a rocket start, and we're coming at you live from the Money Radio studios right here in the Scottsdale Air Park, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If this is the first time you're tuning into our show is about how our older adult population can live a happier life, and how do we make that happen here? It's not about me, it's about the guests we bring to the show, and today is an extraordinary guest. I have extraordinary guests here in the studio to bring to you to really talk about how our older adult population can live a healthier, happier life. I'm really proud to really share with our listeners the three guests I have here. They are innovators. They are looking to reshape the way healthcare is being delivered. And without further ado, I want to introduce you to Dr. Swaraj Singh. He is the Chief Innovation Officer, co-founder, and he's a neurologist. Welcome to the show, Swaraj.
Thank you, Bob.
Are you okay with me calling you by your first name?
That's
okay.
Mm-hmm.
And then just to the right of him, to my left, is Troy Smith. He is the CEO. He's a healthcare professional, been in the business a long time. Troy, welcome to the show.
Thank you, Bob.
It's good to have you. And just to his right, my left, is Dr. Maria Shah. Dr. Shah is the Chief Medical Officer. She is also a healthcare professional in healthcare administration. Dr. Shah, may I call you Maria?
Yes, please do.
Welcome to the show. So we have two organizations that the three of you are part of. AKOS is certainly one, and that is AkosMD. And the other one is Apricus Health. And I'm looking at you, Swaraj. Can you tell us a little bit about both of these organizations?
Certainly, yeah. So AKOS, started in 2016, and myself and my co-founder, Dr. Kishle Anand, who's a cardiologist. So we, basically had being providers ourselves, so we understand the issues with the healthcare today, and we saw telemedicine as to be one of the medium. Obviously, there was no COVID at that time, so it wasn't as prevalent as how everybody has experienced the telemedicine today. So the idea was to bring the access to the people in whatever convenient way possible. So we started out with the telemedicine, but soon realized the way the telemedicine was being approached was in a very isolated fashion. So you get sick, call one of the, download one of the apps, and there is a doctor sitting, and you talk to them for 5 minutes and get whatever prescription. But that does not solve the bigger equation. So we always had an eye on a bigger solution. So slowly it evolved into our first market, or the aspect of medicine we looked at was worker compensation. So if you see, everybody has experienced medicine one way or the other, but if you look at the workers' compensation, there is a lot of regularities and a lot of issues per state, per industrial commission. So there is no uniformity. So that's what we built a full platform around it. We built all the protocols on one platform, connected with telemedicine. Idea was anybody getting injured would get to see a nurse first, and then after being triaged right on the spot, 24/7, get to see a licensed occupational medicine physician. And that way we can help them, get to the right treatment sooner than later. So this, gave us a lot of exposure in the market, and had a full U.S.-based provider base, over 200 physicians as part of it. And slowly, things evolved, and we started focusing on the commercial population, or you can say the self-insured population. So employee benefits, every year cost is increasing. Physicians are not making more, so somebody is, not doing things right. So from there, we started this concept of virtual primary care. And the goal was to not just provide an episodic telemedicine care, but to have a full wholesome care as part of this. So what AKOS has built over time in this regard is a unified medical record portal. So if somebody has let's say they see their primary physician, a cardiologist, nephrologist, so they have a lot of data which is sitting in different EMRs and different systems. And we rely on primary physicians to collect all the data and make sense out of it, but it's just humanly not possible to do that on thousands and thousands of patients you're seeing in a year. So what we have done is brought the various technologies together, so where we interface with different EMRs to bring all the data on that patient in one portal. So now that helps with any physician who's looking at a patient who can get access to a full 360 data. Now they can make better determination on the care. So second thing is that from a patient focus, they have to log in into different patient portals, to get there. Like, I go to this doctor, I need a login for this. Right. I go to this doctor, I need a login to this. So now that problem is solved. So what we do is we bring everything in one place. So the patients are fully empowered to, what lab tests, what type of treatments, they are having. Now, if they end up seeing a new physician, now they don't have to really rely on all the faxes and the phone calls. The patient can actually, share the data right on the spot with the new physician. So that helps with, the overall efficiency in the healthcare. And then the same portal is connected via telemedicine to pretty much all the physicians who are participating in it. So if you need help, yes, there is that doctor setting to help you for that acute and urgent issue, but your specialists are also connected. Your primary care physicians are also connected through this system. So this, brings a lot of efficiency, and then we collect a lot of data which helps us analyze, high-risk population, medium-risk populations, and then we assign care navigators to all the members we have or the members we serve. So care navigators, obviously the goal is to help with the bigger, issues, but simpler issues such as appointment scheduling. I mean, all of us have done appointment scheduling with 20 minutes on the phone just to somebody to say hello on the other end, and then still so we help with any day-to-day issues, medication refills, and so on and so forth. We communicate between your providers, so help with that communication as well. So that portal helps us with the whole thing. So as we progressed, and so we helped Apricus to launch a full health plan. Troy will speak more about it. But the goal is that with the AKOS, the technology is built. Now we are able to provide a much larger scale of healthcare services through one platform. And with that, I'll let Troy, if you want to.
So I do want Troy to talk, but I mean, I want to just kind of bring it down into layman's terms, so to speak. And Troy, we're going to start our second segment in a few minutes. We're about ready to take a break because I want to bring you on to talk about Apricus. But if I were to look at this from a layman's standpoint, AKOS is the brains. That's where all the data and information is. You've created a unique platform where everything is consolidated, right?
That's true.
All of your specialties, your primary care, all that data resides in one location.
That's true. That's true.
No, that is simply awesome. And I will tell you, I mean, I have several doctors I see, and I have to go into various portals. So when you talk about that resonates with me. And one of the biggest challenges we have with older adults is this digital divide. I mean, we've discovered this, and I don't want to dominate our show about talking about COVID and what's happened with this pandemic, but getting folks to register to get vaccinations was all being done digitally, and older folks have a real challenge utilizing technology. So I haven't really ventured into your portal, but I would imagine you've taken in consideration that there is that digital divide, right?
That's true.
And make it really simple for people to come in.
And this is where our care navigator aspect comes in, where we attach a human to a human. so
Nice.
that they don't have to, get online. It's just on the phone will help them out.
That is so important. Especially, it's one thing to be high tech, but it's still at the same time you need to be high touch.
Yes.
And it sounds like that's been the foundation of what you've created here.
Exactly.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Akos and Apricus Health here in the studio. Stick around. We got 3 more segments. We will be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We're in our second segment here, and if you're just tuning in, I have got in the studio, I've got AkosMD and Apricus Health. We are going to talk a little bit about Apricus right now, but if you missed our first segment, you can catch it up on our website. You can go to cypresshomecare.com, click on the media button up on the top right. Third button down is radio show. You'll catch this show and about 400 others we've been bringing to you for the last 8 years. So in that first segment, we heard from Dr. Swaraj Singh, and he was talking about the whole concept behind Akos and the brains behind what it does. It's very innovative, and it really is on the cutting edge, if you would. Started in 2016.
Yes.
And now we are here to talk a little bit about Apricus and the healthcare network that has been created. And I'm not sure when that all started, but I'm sure Troy's going to tell us. Troy Smith is the CEO. Please take it away.
Thank you, Bob. Apricus Health started in 2020, right around the time of COVID hitting, so it was interesting there. We have grown with an amazing amount of velocity in the last year. We have over 300 primary care physicians as part of our network.
Wow.
And over 500 specialists. Our network is made up of employed physicians as well as affiliated physicians, all designed to be able to deliver high quality care to our members. We are one of 50 in the U.S. that has received approval from CMS for the new innovative payment mechanism that CMS launched as of April 1st, 2021, and that is called Direct Contract Entity. So we will be working directly with seniors that have traditional Medicare and are part of our network starting April 1st.
That's exciting.
Yeah, it
That
is.
is really, really exciting. And, when you sit here and you describe your network, I almost I can't help but think of like a Medicare Advantage plan, because that's kind of how they're set up.
Exactly.
But you aren't a Medicare Advantage plan. You're partnered with them, right? Is that how you guys work?
That's correct. So we're very similar because we do accept risk, which means that we receive payment from the Medicare Advantage plan or from Medicare, and we work to help lower the cost of care through a variety of mechanisms. We use Akos as our technology platform to help us do that. The platform is unique in the industry. We follow our care model, which is at home, near home, and then utilizing care navigators to make sure that someone can help the patient navigate the healthcare ecosystem. Because the healthcare ecosystem can be somewhat confusing. I've been doing it for over 30 years, and I still don't understand it. And so we want the patient to be able to access care when they need it, where they need it.
And I think, Swaraj, you were talking about that. You were talking about a navigator because, when we were talking about EMRs and, the fact that there's so many of them out there and the fact that your Akos is really rooted in technology. And we talked about the digital divide. Having navigators help your patients navigate through that it's got to be a huge bonus.
It's amazing, how much. We think with the era of FaceTime and all the mobile phones, But once it comes down to, your health, and especially the elderly and the senior health, it's the technology is a big divide. So we felt this very early on, and whatever, we can create, Rolls Royce of technology, but if you don't have a driver for it, it's not going to work. So that's where the concept of Care Navigator comes in. So we want it very simple. A push of a button, Navigator appears in front of you if you have the video camera or a laptop, or just call us on the phone. And if the interaction needs a video still because there's something the doctor would like to see, it's as simple as sending an SMS message to the person on the other side. No apps to download. Click the link, and you're connected. So to make it very simple, that's been our core focus on that.
I'm so appreciative of you three being here, because it sounds like you subscribe to what I believe in, and so many do, and that is we want people to stay at home.
Yes.
We want to avoid that medical event from having them go into a hospital, getting into an emergency, or getting into an ambulance and going into the emergency room. And, utilizing your innovation that you guys have created over at AKOS and the platform that you have over at Apricus, sounds like that ensures that, and it really helps us keep people in the place that they want to be, and that is at home.
Well, the nice aspect about our telehealth platform is it's our own technology, number one, so we don't rely on anyone else. And number two, you can have up to 99 participants in the telehealth visit. That's very important to seniors. So, for example, if you have a patient that can connect not only to their primary care physician, but also their cardiologist at the same time, also their neurologist at the same time, and another family member that might be a caregiver along with the care navigator, and all can sit in on that telehealth visit and participate actively with regard to the treatment plan that's being constructed for them and the prescriptions that they need to get filled, things of that nature, all right there at the same time.
You don't see that. You see silos, and this is really unique. I love what you guys have created, and the fact that you are one of 50 that are participating in this new payment program through CMS. Obviously, CMS sees the innovation that you guys have created.
Absolutely, and we're very proud of the fact that we're going to start April 1st. We got a lot of work to do between now and then, but we're looking forward to it.
We got 1 month. I mean, March 1st is Monday. It's hard to believe it. So I would imagine you might be working over the weekend.
A little bit.
So, Maria, Shah, you and I have had a chance to talk before, and I am so impressed with what you've created. And you are the Chief Medical Officer. When you and I spoke a couple months ago, we were talking about critical care management and remote patient monitoring. And I'm making the assumption, I could be wrong, but that kind of falls in your bailiwick, right?
Yeah, it does.
So, for our listeners, could you explain what that is and how vital that is to the care continuum and the patients that you guys are serving?
Definitely. So I've actually been blessed because I've been able to work on both AKOS and the Apricus side. So I've worked with the technology as well as the physical footprint that we've built here in Arizona. So from the technological aspect, for seniors to be able to have access in their homes, to stay in their homes with these devices, our devices are 4G enabled. That means they have a SIM card, so it doesn't rely on Wi-Fi or a smartphone. So the devices themselves have the ability to transmit that data to the AKOS platform for all of our physicians to see. So the technology that we use, we do remote patient monitoring, blood pressure cuffs, a spirometer, pulse ox, thermometer, weight scale, and a blood pressure cuff. Those are the 6 devices we currently have. Those devices enable us to monitor patients' results from home in real time. So as soon as those measurements are taken, within 30 seconds, they're visible in our portal. What that enables us to do is each of the providers that are on our portal can set specific parameters at a patient level to be able to be alerted once those measurements are out of those parameters. So that enables for our care navigators at that point to kind of check in, call, see if everything's okay, if there's any type of intervention that can be performed prior to sending it on to the physician or provider. And then, if there is the need for that provider to get involved, then we get them either on a telehealth visit or on the phone or in an in-person visit if that warrants. So it's very exciting to be able to keep the patients at home for most of, these violations of those parameters, rather than having them either go to the urgent care ER or even the provider's office.
I love how you describe that. And because I envision, people, at least lay people looking and thinking that you've got somebody working in a control room, looking at all these monitors, and you're hoping they don't miss something, but you're utilizing technology, and the parameters you're talking about are, if this person's blood pressure goes above this, or their blood sugar goes below or above this, there is an alert or an alarm that goes off. Mm-hmm. So essentially, you're allowing the computers, artificial intelligence, if you would, machine learning, to be able to go ahead and push that information to the correct person so an intervention can happen and prevent that medical event that I was talking about.
Correct. And that's the benefit of the care navigators as well, because they've already established this relationship with the patients. So they're comfortable when the care navigator calls and says, hey, your blood sugar looks a bit too high. Did you have something, that you don't normally eat, and that's the reason that your blood sugar spiked today, and they feel that comfort level and being able to share that with that care navigator, and then we can pass that on to the provider.
So let's talk a little bit about the care navigator. So the care navigator, we're utilizing technology, the foundation of it being with AKOS, and the care navigator is connecting through technology, or is there human contact?
It's human contact, and that's really where we kind of marry technology with human contact, because especially for the senior population, it's very important.
I want to talk a little bit more about it. We're halftime here at Health Futures. I've got AKOS and Apricus Health here in the studio. Stick around. We got one more half. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And if you're just tuning in, we're in our second half here. And I'm proud to have AkosMD and Apricus Health here in the studio. I have the pleasure of having Troy Smith, the CEO. I've got Dr. Swaraj Singh. He's the Chief Innovation Officer. And I got Dr. Maria Shah. She's the Chief Medical Officer. And when we left off, we were talking about the integration between AkosMD and Apricus Health, and how AKOS is the brains, the technology that really powers what they're doing at Apricus Health. And I also left off talking to Dr. Maria Shah about some of the things that they're doing in terms of the technology. And she was talking about these navigators. And when we left off on the second segment, I talked about, is it human contact, or are we still using technology? And that's kind of where we left off, and I wanted you to pick up from there. So,
sure.
We can get a lot of data from utilizing the devices, but how does the human contact come into play?
Sure. So once a patient comes into our ecosystem, we do a HRA, a health risk assessment, and this is conducted by the care navigator. So each of our patients is assigned a dedicated care navigator. So that person will be the same person they talk to each and every time, so they can really establish that relationship. So once that HRA is conducted, we gather what we call a health risk score, and that pretty much puts them on the ranking of how from a high risk to low risk patient. And at that point, we either assign a nurse, or a lower risk person would continue with their care navigator for their needs. And once that HRA is completed, we do an individualized care plan, and that's kind of where those RPM measurements come in, where we put the parameters for the providers. So each person goes through what we call a curriculum-based intervention. So if they have diabetes and hypertension, they'll be put on that clinical track for a diabetes program for a course of 12 months to kind of bring down that A1C, lower their weight. And the same thing for hypertension, any type of lifestyle or behavioral modifications that we can do for them. This is in tandem with their primary care provider. We have EMR integration with the providers, with the PCPs, so the PCPs don't actually have to come into our portal if they don't want to. We can actually just push that data back into their EMR for them to pull up whenever they want.
That, to me, is so cool. So Cerner, Epic, all you guys talk to one another. You're able to push that interface does exist for you guys.
Yes.
Wow.
Yes. So we can interface with any type of EMR, and the data will go back and forth. So we can pull patient rosters and work on that data. And the same thing at the we can push that data back into their EMR for those providers to take a look at. So for those when those measurements going out of the parameters that we set for them, we can push that back into the EMR for the provider to view. So then again, it's not added burden for the provider or extra time. They're just working within their own system.
Makes so much sense. And you use the word RPM, and I want our listeners to know that's remote patient monitoring. And the other thing we talked about earlier is critical care management. And if you could, for our listeners, describe what that is.
Sure.
and the value that
Sure.
Apricus and Akos bring to that.
So our model is very unique that we combine chronic care management with remote patient monitoring. So chronic care management, if you have 2 or more chronic conditions, and that's defined as a condition that's expected to last 12 months or more, we'll put them in this program and make sure they qualify for a remote patient monitoring device. So we pair the 2 programs together. And that's where the behavioral modification, the lifestyle interventions come in. That's for the chronic care management program, and the care navigators will kind of guide them through. Our program is SDOH based, so social determinants of health. So most seniors, one of their biggest barriers to getting to a primary care provider or to their appointments is transportation, and obviously this is pre-COVID.
Right.
But even in the times when a in-person visit is needed, we can arrange that transportation for those seniors to be able to get to those appointments. So the care navigators will create the appointments for them, make sure they can get there and home. We have free delivery of RX to home, same-day delivery services. We also have a list of about 15 medications that we can deliver free to these populations, and then a $3, $6, and $9 formulary with some of the partnerships that we have with pharmacy. So it's a lot of different resources that exist currently in the community, but we've brought them all under one roof, under one care navigator. So it's a one-stop resource for our patients.
So that care navigator, I liken that person to being like the quarterback.
Exactly.
They are
exactly.
They are the one. Everything's centralized through them, and they are the ones that get all the various specialists and entities together to make sure that you are keeping that patient
Exactly.
safe and at home.
Exactly. And we mentioned earlier that, healthcare is so siloed between specialists and the primary care providers, and that's really the beauty of the Akos platform is we can bring all of those records into one location so that if, I as a PCP see a patient and I'm not sure if the cardiologist or the neurologist changed medications or, changed a treatment regimen, all of that is in our portal, so the care becomes much more wholesome rather than fragmented.
So you obviously have embraced technology and innovation, and you also are still able to do the on-ground visits. So you're able to do both for your patients that are on the system.
That's true. And, also what we have is a very unique, I would call it as a, telemedicine 2.0. So the most of the time, if you look at historically about since 2004 or 5, where telemedicine has been around in US, the biggest, critique has been is overdiagnosing. So somebody calls with ear pain, and you could broadly have a, allergic ear pain or a bacterial ear pain or a viral ear pain. Unless somebody looks into the ear, you can just guess, or teleguess, we call it. And then because the patient is anxious and you are on this side, you end up prescribing more antibiotics. And actually that has led to quite a bit of studies around it that it's not a good policy to do that. So we realize that. So what we have done, again, with a very good technology partner who's locally from here, build these automated clinics, or med clinics we call them. And some of your listeners might have seen, and Safeway has been a very excellent partner for us to given us the playground to expand these this technology. So what happens here is when somebody goes in, there is a medical assistant, who will help them, and it's all is automated. So even you don't have to type in anything. So you scan your driver's license, you scan your medical insurance card, everything is, picked up. And then it's almost like if you have interacted with the chat bot. The idea is that, but it's very extensive. It will ask you all those questions which your physician might not have even asked you in your interview with them in the similar situation. So you can start with any chief complaint or multiple chief complaints. and go over the full interview. And then at this point, the navigator will take you to a fully HIPAA compliant, soundproof room. And you sit in front of a computer. Computer guides, medical assistant is there to help. But the difference now is for me as a physician to, take that history, I need that physical exam piece. I need to listen to the heart sounds, lung sounds. I need to look into that ear, that throat, and so on and so forth. So with the help of these augmented reality and machine learning, we are able to capture that information.
Nice.
And put it on a server where physician who is remote is able to listen or hear or look at this information before even connecting with the physician, with the patient on the other end through that telemedicine link. So now the physician comes on and say, okay, I see you're calling for sore throat, and I looked at your throat and it doesn't look as red, so I think we are good, and just takes some ibuprofen and that's it, right? Or I can see a pus there and you need antibiotics, and so on and so forth. So it makes so much easier, as well as if physician needs a little bit more exam, so navigator can help put on the camera and the live link, we can do that. As well as if any labs need to be drawn, a urine needs to be drawn, so we have that facility in these locations. So if you think of future, how medicine is evolving, the concept is near home, in home, near home, and then into a big facility. And obviously all the people who are really sick needs to be in the hospital, so that's our goal, that we can manage you at home, if not into these near home situations. And if really somebody is sick and they really need to go to the ER, then yes, they should be in the ER.
But these locations that you have, I think you mentioned Albertson Safeway.
Yes.
They're partnerships that you already have. Troy, I think you mentioned there's one like right down the street here for Frank Lloyd Wright.
Absolutely, yeah. We've licensed up to 34 sites. We're expanding into northern Arizona as well. We've identified, I think it's additional 5. And Albertsons Safeway has been an excellent partner to work with us on this, to be able to provide that access should you need to have that near hands-on care and you can't get in to see your regular primary care physician, but you do want to actually be treated. We offer that as an outlet as well.
You guys have thought of everything. You really have. I mean, seriously. I mean, you've got the tech, you've got the touch, and access points, like you said, either at home or near home. And near home is Safeway and Albertsons, where we shop. And especially if you need labs drawn. I was going to ask you that question, and you answered right at the end when you were talking about that. Well, we got a little Marshall Tucker band taking us out. Well, thank you, James. That's an old school one. I really appreciate it. You've been listening to Health Futures Taking Stock in You. I've got AkosMD and Apricus Health here in the studio. I got Troy Smith, I got Dr. Singh and Dr. Shah here. Stick around. We got one more segment. We're going to ask them what they foresee the future is, because they already are in the future, but I want to take it one step further and really talk about the future of healthcare. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and we are in our last segment here. And if you're just tuning in, I'm really pleased to have AkosMD and Apricus Health here in the studio. I'm pleased to have Troy Smith, who's the CEO, Dr. Swaraj Singh, he's the Chief Innovation Officer, and I've got Dr. Maria Shah, she's the Chief Medical Officer. We've talked about a lot of different things here, and innovation has really been at the forefront, and I'm looking at you, Swaraj. That is amazing what you guys have created in just the last almost 5 years.
Yes.
And sitting here, listening to you, Troy, talking about you're part of this new payment plan through CMS. Obviously, they have really embraced your innovation and what you're doing, and just fascinating that you've already integrated with all these different EMRs and able to use the platform that you created and being able to push information to other medical specialists that may not be on your platform but are able to get that data. So, and we also talked with Dr. Maria Shah. We talked about the utilizing innovation, but really talking about the navigator and how the importance of that navigator in the role of that patient care and making sure that patient gets what they need to prevent a medical event from happening. And you also, Maria, talked about RPM, remote patient monitoring. You talked about chronic care management and how that all plays into it. I really want to sit down and really talk about now. The next step is, our listeners, if they want to get a hold of you, I have a website, AkosMD. That's AkosMD, as in doctor.com. Or they can call 1-844-900-2567. And Troy, I'm looking at you because being the CEO and having a really robust background in healthcare and health plans, I know listeners are going to be listening in. How do I sign up? Medicare Advantage? Are you contracted with any of the other health plans out there?
That's a great question, Bob. We're currently contracted with Devoted. They're a Medicare Advantage plan. They are in Texas, Florida, and most recently launched here in the Phoenix, Maricopa County area as of January 1st. We are also in active negotiations with a variety of different health plans that are doing business here, and we're looking forward to working with them and being able to treat their members and bring them a part of the Apricus Health family.
That's and Apricus, as you shared, you started right during the pandemic. So you've been doing a lot of work, and April 1st is a deadline for you to be up and running on this new CMS innovation portal or program.
Absolutely.
So I know you got your work cut out for you, but you've accomplished a lot in such a short time. Rumor also has that you're building a medical center. You want to tell us a little bit about that?
Yeah, so in Avondale, just on the west side of Phoenix, we have a micro hospital going in. This is, again, designed to be able to apply our care plan and care model. So at home, near home, if you can't get it and you need to go to some other place, you have to have that surgery. We have an ambulatory surgery center as well as a imaging center for those high-tech imaging. So MRI, PET scan, CT, things of that nature will allow us to be able to treat patients from that perspective. So it's going to be an exciting year for 2021. We'll launch our first one. I think it's going to go live in April as well.
Nice.
And then we'll be rolling out our second facility in Surprise.
No, really awesome stuff that you're doing. Really, when you sit down and you think about what you've created in just such a short time, you are certainly disrupting the way healthcare is being delivered, utilizing innovation. When I think about innovation and I think about the use of technology and how you've married it with the high touch with the navigators. And Troy, you've said it repeatedly, the care plan is really the crux of really delivering patient-centered care is what that care plan is. And that care plan it varies by patient. It varies by what their comorbidities are. And you guys are exceptional at doing that and then making sure that people are keeping to those and keeping accountable, especially utilizing innovation and technology. So as we get ready to wind down the show, I'd love the three of you to talk to me and talk to our listeners about the future. You guys have embraced a lot of futuristic stuff, but what do you see coming down the road in healthcare and healthcare delivery? And Swaraj, I'll start with you.
Certainly. One thing I would, for AKOS and the Apricus to succeed, a lot of technologies have been built already, and we were like I should say lucky enough to have everything at the right time. If we were doing this in 2008, a lot of things weren't possible. So the iPhones couldn't carry the bandwidth, and similar all the devices and so on and so forth. Now with the 5G and hopefully they already started talking about 6G. That certainly changes a lot of things. So we can run multiple streams of data coming in and more effective virtual care. And think of certainly Phoenix being a more metro, but then there are rural communities. So imagine the level of care we can provide with these technologies coming around, and access to technology as it grows. We can see a cost come down. Health outcomes are much better. Less utilization of hospitals, and hopefully less complications. So that's how I'm foreseeing the future,
especially rural communities.
Yes,
I definitely see that.
Yes.
Maria, would you like to chime in? Tell us a little bit about what you're foreseeing.
Sure. So with the shortage of providers and doctors in the country, I think that technology is going to play a major role. COVID, for a lot of businesses was a bad thing. Unfortunately, it kind of helped us with the innovation and helped us with moving forward with a lot of what we were trying to do. So with these rural areas that have no access to healthcare, I think this is going to be one of the major players as far as, with the remote patient technology as well as the telehealth portal and platform to be able to deliver care in those areas. So I see a lot of innovation in that area.
Love that. We have about 30 seconds left, but Troy, I'd love to get your take and also if you want to leave us some lasting thoughts for our listeners.
Sure, Bob. There'll be a convergence amongst healthcare providers as well as pharmacists as well as insurers, and you can see that as an example with Aetna and CVS. They've combined and merged just recently as well. Arizona is going to be a little unique as the country continues to go through the aging. Arizona continues to outpace the rest of the U.S. with regards to primary care physician shortages. And so you'll see a lot more innovation and the ability to be a little bit more innovative in the community to deliver care.
I agree. I couldn't agree with you more. We are an aging community here in the state of Arizona. AKOS and Apricus Health, Troy Smith, Dr. Swaraj Singh, Dr. Maria Shah, thank you so much for being on Health Futures. Thank you for enlightening me about AkosMD and Apricus Health, as well as our listeners. We'll be back next Friday. Make it a great day. Have a great weekend, and thank you.
Thank you, Bob.
Thank you, Bob.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3